And I was a student of this great institution. I was here in 1968 for 1 year as a PUC student. But I have an excellent memory of this institution. How was it? And I also was laid a foundation from this institution, especially under the dynamic leadership of Padma Bhushan H. Narasimhaiah. I always remember his guidance. That was the year, unfortunately, he was not here. He went to USA. But he wrote a letter which was circulated to each and every student at that time. I was just 15 years old. I still preserve that letter. And such an inspiring letter, I cannot forget. So I consider this as a great privilege and an honor to stand in the H. Narasimhaiah Memorial Hall and talk in front of all of you today. I have chosen an interesting, different topic. Before I start on this topic, I want to ask you questions to the audience. What do you think is the most important discovery of the 20th century? Anybody else?
Mobile cell phone.
Cell phone. Anybody else? Internet. Anybody else? Anything? Sorry? Telecommunication.
Vaccines.
Yes. So, you have heard the various parts of the innovations which has happened in the 20th century. But as most of you said, it is the telecommunication which includes mobile phone as well as the internet which stands out. But for all these things, you did not mention one important aspect. That is the discovery. What is that discovery? No? Chip. Somebody said here, the correct word, that was chip. What is a chip? A chip is the computer chip. And that has revolutionized the whole thing in the world today. Without a computer chip, you can't think about anything in this world now. Whether you are talking about a small machine in your gadget, whether it is in the form of a washing machine or a dryer or a microwave, or you think about a computer in your house, you cannot think about anything without a chip. And the chip is the basis for many, many wonders which has happened in the 20th century. And all the discoveries, whatever has happened subsequently, whether it is in the form of a CT scanner or an MRI scanner, without which a doctor cannot live today. Not economically, but also without having that with a patient. It is a very, very important tool now. Any tool you take, you cannot run anything without a chip. But whenever you are thinking about anything in your mind, always you have to think about positive and negative aspect. For everything there is a positive aspect, there is everything there is a negative aspect. I yet to find something which we can say only positive. Many patients come to me, being a doctor, they ask me a question, "Sir, does it produce any side effect?" My answer for them is very, very simple. Let me know any drug which is 100% side effects free. If somebody tells you that, he is telling a lie. There is not even a single medicine without a side effect. Every medicine has its side effect. Every drug has its problem. So now we know that whatever the drug which we use today has got side effects. Even the food, for example, or the food preservatives, other example, has got any advantages, but at the same time it has got side effects. So do you think that what we have heard today as the 20th century wonder is only positive? Anybody? Because you have already read the title there. Otherwise, you think that yes, it is positive only. But unfortunately, it is not that everything positive. we are now beginning to realize there are lots of issues which are involved. So I thought that I will talk to you today about a condition which is known as technology addiction. You may wonder, what is this technology addiction? Have you heard about any addiction word? Yes. What is that addiction? Alcohol, drugs, then tobacco, smoking. Smoking is the addiction habit.
Mobile addiction.
That you are talking today. That is what exactly I am coming to the point. So the people are talking about the tobacco addiction, talking about alcohol addiction, and we also talk about substance abuse. The word substance abuse has replaced now the alcohol addiction. Because it is not that alcohol itself causes the problem, but the other substances are also there, which could be in the form of a drugs or it could be in the form of a tobacco. So we use the word substance abuse or a substance addiction. So you all heard that we all know that it is addictive. But why do the people take it? Can anyone answer that question? We all know alcohol is bad. We all know smoking is bad. But why do they take? They think that the mind cannot control that. Anybody else? Any answer?
They get some pleasure out of it.
They get pleasure out of it.
There is craving.
There is craving. So you have given me all the answers what I am going to talk to you about. So this addiction is a problem now. And that addiction gives rise to craving, pleasure or a kick, whatever you use the word, and also you cannot control it. So now technology we come to whether it causes a problem like that. That was the study which has been done in our own institute. And now we have the evidence and the proof to talk to you about what it can cause, this technology. Let me go through the slides. You can switch off this front slide, if it is possible. Yes. So we will talk about technology addiction, which is a public health challenge now. It is a major challenge which we are all facing now. Next slide, please. Oh, sorry, I have to do it myself. What is this technology addiction? It is a repeated tendency by users to engage in some specific activity despite harmful consequences. I am stressing the word harmful consequences to his or her health, mental state or social life. These are extremely important words which you need to remember. In spite of the consequences, that person knows that it can cause problems to health, mental state or a social life. The person indulges in this. These activities now includes the cell phone use, internet use, being on a Facebook, texting and pornography. These are the problems which you are facing now. I am happy that there are some young people who are also sitting in the audience. They have to know about these things. What does this contribute? Why this technology use led to this or overuse? One of the commonest thing is accessibility. Can you, in this audience, anybody without a cell phone, raise your hand? No, in your life, and you should not have used.
No, I used, but
Not today, not today. I am talking a person who is not having a cell phone. You don't have a cell phone?
no.
Never have a cell phone?
No.
I have seen 4 of you. Here one, 5. It is becoming a very, very strange person that you don't have a cell phone now. It is an odd man out. That is what we always say. A person without a cell phone is now an odd man. Just about 10 years ago, when I went to Thailand, I used to see the cell phone there. And I was admiring, what is this small tool everybody is carrying? Then I went from Thailand to England. I saw people walking in the road talking to themselves. I said, what is happening to these people? I was not aware. What is happening. They are walking in the road talking to themselves. Then I used to look at them, and then there was a small while, and then they were listening something and talking to them. It is such a strange thing which used to happen. But now I know that in this country, this is becoming a very, very common. And there is no person practically without a cell phone. That has become very, now in this audience I have 4 people here. I think I should quote this wherever I go from now on. Because I yet to come across a person without a cell phone now. Whether they have food to eat, but they will have a cell phone. I have seen a beggar with a cell phone. I have seen a person who is working under the ground in a drainage cleaning area. A sanitary pipe, he will be cleaning under the manhole with a cell phone in his hand. So that is the extreme degree we have seen now. So this has become accessibility. That means everybody can access a cell phone now. That is the wonders in technology. Easy availability for usage, across various age groups. Control. Somebody said about the control earlier. User sense control in terms of whatever he or she can do with that. The third person, people said pleasure. You have an excitement. An excitement which users feel very good about it. And that is the reason it leads to technology use or abuse. These above-mentioned factors can contribute to excessive use in some of these cases. That is the problem. Next slide, sorry. I always forget that. In a man's experience, already the slide has come. I wanted to ask you, what do you think is the youngest person who can use a mobile phone now? 4 to 5 years. I don't know whether that girl has come here. I had actually asked that girl to come over here. There was a girl, a small little one in first standard, whom I met across in my outpatient on 2 days back on a Wednesday. And the father was very happy to say that my little girl is just about 6 years old and she knows everything about the cell phone. And she can open the Facebook, she can have access to the Facebook, and she texts also. I don't know whether they know ABCD, but they will text. That is the issue now we are talking to. That is the problem. And this girl, I asked her, said, why don't you come to this lecture I am giving on such and such a day? So I don't think she has come today. The little smart one, that was about 6 years. So we did a study at Tim Hans, and in the study, what we have seen, age of onset of Facebook, we have 11 years. Age of handling a mobile phone, 4 to 5 years. You may be surprised, but that is the fact. And this is not a toy phone. Huh? Don't think that it is a toy phone they are using. They are using the regular mobile phone. The cell phones they start using at 4 to 5 years. Problematic internet use along with psychological distress we have seen in the age group of 18 to 25 years. We had a sample of 400 people we have surveyed in 2011, and we showed that 8% of them had a psychological distress following the use of internet. Addiction to social media. Now we all talk about social media, even in the elections which were used. Now everything about in social media. We talk social media in the big way. 18 to 25 years. We had 350 sample size where we showed 5.2% had social media usage addiction. So that is the problem. So the technology addiction in the community is in the age group maximum is found between 18 to 65 years. The maximum addiction is found in 18 to 65 years. We had 2,750 samples. The internet addiction, what we use as internet every day, people get addicted to that. And that addiction was seen in 1.2%. 1.2% may look very small figure today, but you must think about 1.2%, about 80 million people in this country. We have 1.2 billion population, and I was told that the official figures, there is 80 million cell phones users now in this country. It is the biggest market in the whole world. And what they use among the addiction, in the internet it was 1.2%. 2% was in male, 0.6% is female. Shopping, now we all know about online shopping, offline shopping. Everybody does online and offline shopping now. Addiction was seen in 4%. Male was 3.2% and female of course was much higher in the addiction to shopping, which was an online shopping nowadays, and that was 4.8%. Sex addiction, online pornography is 0.2%, which is a small figure, but still with the usage it has gone up so much, 0.3% among the male and 0.1% among the female. Cell phone addiction, this is all about the internet addiction. I am talking now about the cell phone addiction, is about 4.1%. 4% among the male and 3.2% among the female. Gambling, online and offline, has become a major issue now. You go to any office now, they are all busy. But you have to tell people what are they doing. That is what you have to need. You know what they are doing? Anybody?
Share market.
Share market. That is the gambling. Everybody is very active. They don't have even time to look at you if you ask them. They say that please sit down. Please is the word which I have used. They may not use that. They will say sit down. Because they are very busy. Because within a minute they may lose that money. And that is the share market. And that is again gambling online and offline. 1.2% more among the male. What is the problem what they are facing? Physical and psychological distress was present as a morbidity in 6.8% with the mobile phone addiction, 4.2% with internet use, and 3% with the social networking site. They have a distress. That distress is very obvious. Both physical and psychological distress. But still they want to use that. Without that they cannot sit. That is the problem. The pattern of addiction is certain people are more used to this addiction. We can identify them. Who are those people who are at higher risk about this addiction? Those who are single, they are the people who are more addicted to that because there is no other way of spending time. Lesser in people living in a joint family. More you live in a joint family with a lot of people around, you have less addiction. You are alone or at the most two people. As soon as you come back from home, from work, what is the next one? Either television or a mobile phone. And a mobile phone start just texting. That is the problem. You must be getting, I don't know how many of you get every day, the texting. There is a habit. One thing, one message you get and that message will be circulated to everybody. That is becoming a habit now, a chain of events. And that is becoming addicted. The single people, more than a nuclear family, single parenting has much more problem than a joint family. Single parenting is a major issue. Wherever there is a single parent, that child has got a major problem. And such children are more prone for addiction. And various addiction, it is not only the technology addiction, they are more prone for substance abuse addiction also. Technology use among the teenagers in the range of 13 to 17 years, they are the most vulnerable people. 13 to 17 years, excessive use is there, video game, Facebook use, 20% there. 20% of the teenagers start using this Facebook. Once they hooked into that, continuously they will be on Facebook. And then you must have seen as parents, your own children or grandchildren must be indulging in all these things in your home. Experience distress also due to an online sexual content also. They have a lot of problems when they are reading that, but they cannot understand, they cannot do. Am I developing addiction? Is the question. You yourself might ask a question when you are using a mobile phone or internet or a Facebook. Am I an addict? That is the question which goes through. I say yes, if any one of these things are there. There are 4 C's which you have to remember. There are 4 C's. Some answers have already got it. The first one is craving. You said craving, sir. Craving is the one. Desire to be with technology device whenever one gets an opportunity. The moment I have a time, I will not be looking at you, I will be looking at my mobile phone and go on doing the texting and then see that. That is the first thing. Craving is there. Without craving, you can't do anything. Control. The loss of control once you initiate the use. There is no control at all. You can't go on using the cell phone technology. Compulsion. Experience the need to use though there is no need for it. You don't have a need to use a mobile phone now. For example, here, you are all sitting here. But there are some people who continuously texting even now when there is a lecture is going on or when somebody is talking also. What is the need there? There is no need. But they think that they want to do it. They have to go on texting it. That is the compulsion. Then consequences. So we have 4 words: craving, control, compulsion and consequences. There is the health consequences, which may be in the form of eye strain, sleep disturbances, even they can go on in the night, start doing the texting and working on internet and going through the Facebook. Academic problems, relationship problem, recreational problem, inability to handle online rejection due to decrease in the communication bonding with offline supporting. The problem what happens is they do not mix with the people. They are isolated. They do not need anybody. They work with only the mobile phone or internet. The moment they get this contact, they are off into that. So there is a problem with the relationship. There is a problem with the social ability. They do not have an ability to interact. Nowadays you must be finding many people, parents come to us, this boy has a problem. What is the problem? The problem is that he doesn't have any friends. Is it a strange comment? But it is becoming more and more now. Their parents are worried that they don't have any friends at all. You know about the girlfriend or a boyfriend, that is different. I am talking about you have a friend. They don't have a friend. Then how does he spend time? The moment he comes back, he is with the internet. The moment he comes back, he is with the mobile phone always, or TV. This is the problem which has happened. If anyone has 3 or more, it indicates need for screening, whether there is a problem. But one word of caution there, it does not apply to the people who are professional. For example, I am a software engineer, naturally they have to be with that. This does not apply. Is it different from any other addiction? That is the question which is asked. So I told about the alcohol addiction, substance abuse addiction, or tobacco addiction. Let us compare now. Talk about technology versus other substances which you are using. For example, craving. Yes, there is a craving even for a substance abuse, and that is why people start using that for the substance. Technology addiction, yes, it is in the same way for technology devices. Then tolerance and a loss of control. Yes, increased amount to achieve the same effect. This is called tolerance. For example, a person who drinks an alcohol, he starts with a small quantity only. After some time, it goes up. After some time, it goes up. He starts drinking larger and larger quantity because he can tolerate it more. Similarly, the same phenomenon occurs with technology addiction. As the time passes, he gets into tolerance, and that is why increase in the amount of time spent on the technology devices and a loss of control. When you withdraw, what will happen? An alcohol person, you ask him, why don't you withdraw it? It is very easy to say. He says that I have tried many times, I have a problem. What is the problem? I cannot face the problem. I get jittery, I am getting my hand shaking, my trembling occurs, and I have fear, I have phobia, I have anxiety. All these explanations they give. That is physical and psychological occurs, withdrawal occurs. Similarly, even here, with the technological addiction, they develop restlessness. They feel very, very restless. They can't sit, irritability on discontinuation and asked to stop. They are extremely irritable and restless. They cannot sit in one place and they become almost addicted to that. Consequences, dysfunction can occur in physical and psychosocial area in both the ways. That means the technology addiction is as good or as bad as the other substance abuse addiction. There is no difference at all. Next slide. Sorry. Healthy versus unhealthy technology use. How much is too much internet usage? This is a question all of you will ask. When do you call this? When you feel more comfortable with your online friends than the real ones. That is the time. You are more comfortable with online friends, not the real friends at all. That is the time all of you should think that you must be having a problem. You can't stop yourself from playing games, gambling, or compulsive surfing. This is a compulsive behavior. That is the time we say that this is unhealthy. You start neglecting your relationship. That means you don't care for your friends, you don't care for your family, You don't have anybody attachment with you. You get attached to only this technology. And then it causes the problem in the relationship, in the family, in the school, and daily basic needs. That itself comes into problem. It starts having negative consequences in your life. So who is at risk in developing addiction? From the world literature, I am talking about it from the teenagers and youth. They are the most prone for that. Excessively shy and introverted teenagers. They are the people. If you have any of your friends who are totally introverted, you can find out how does they spend time. This is what exactly they say. Higher levels of depression they have, compulsive tendencies, impulse control disorder, and low self-esteem. That is a major problem in all these people. They don't have a self-esteem at all. Their self-esteem goes down so badly that they do not have any confidence in themselves. That is a major problem this addiction leads to. There are psychiatric morbidity. You may wonder, how does this harm anybody? Yes, it harms an individual. The harms are in the form of depression, hypomania and dysthymia, which is seen in 33% of these individuals. Most common psychiatric comorbidity. People with anxiety disorder, psychotic symptoms, attention deficit disorder. These are the people who have, when people have eating disorder, they have much more problem with this one. Substance dependence also, they have a problem like this. Now, it is so common, it has become included in the classification of psychiatric disorders. Consequences are 40% of kids are exposed to online porn now. 40%, can you believe this number? It is a fact in the world literature. 10% of those become very or extremely upset about it, according to our own study as late as 2014. 66% of the teens report cyberbullying, sharing of passwords, unaware of the consequences. These are the problems, which are the new words which we have to learn now. These are all becoming very, very common. Patient shows concern and ignorance about this. Dysfunctions could be in many ways. What it leads to, you must know the problems what they face. The problems are physical, eye strain and sleep disturbance, psychological, restlessness and irritability, psychological distress. There is one more word, new word, that is nomophobia. What is that nomophobia? Fear of losing your mobile phone. They are so much fearful that they always will be looking on the mobile phone, thinking that they may lose this. And users preferring online interaction in comparison to real relationship, lacking support to handle online rejection. Facebook depression. This is a new word again. These are all the new words which you have to learn now, because this has all come because of the Facebook now. More than half of adolescents log on to social media website at least daily. And about 25% say they log on to their favorite social media site 10 times in a day. Can you believe that? And problems with the self-esteem and depression is the most common. They compare themselves to the friends and photos of people looking happy and feel bad. That is the problem with this Facebook. They look at others and feel that they are all happy and they feel they're bad. They are themselves are going to that level of self-esteem going down like anything. Lacking adequate coping skills and hopelessness is very, very common. And then studies with adults show similar relationship to time on internet and depression. How do you treat these people? That is the problem which everyone asks the question. It is the same mechanism for any other addiction. Addiction is one of these things which are very, very difficult to treat. It can be prevented rather than treated. One needs to prevent. That is why always we must identify the people who are more prone for at risk. That is the reason I was spending a lot of time to tell you who are the people who are more prone for these addictions. That should be identified early. There is no particular form of treatment. We have most frequently approaches cognitive behavioral therapy, enhancement therapy. These are all psychological therapy which we have by the psychologist who does this. We have a good psychology team in our institute, and there is one person by name Dr. Manoj Sharma who has done a lot of work on this, and he is involved in this treatment. It is very easy to say abstinence. Abstinence is very, very difficult. It is impossible practically. and controlled use is the better word. And there is a web-based treatment facility, marital and couple therapy, family therapy. Combination of these therapies are required for solving this type of problem, because this leads to various other psychiatric comorbidity. They may require even the drug treatment when it leads to that level. Some steps to work on the technology addiction. There are certain things which you all should help yourself to see it as a problem. First thing is technology addiction is a problem. That should be identified. If you don't identify, it leads to more problems. So please identify this as a problem. It is not an ordinary joke. Set goals for users of technology. Replace your technology usage with a healthy activity. Build your coping skills. This is the most important. Coping skills are extremely important. If I am depressed, I need to develop certain coping skills. You may look at the television, you may listen to the music, you may talk to the people, you may go out and spend some time, rather than hooking on to the tobacco or hooking on to the alcohol. The same thing happens here. When a person is depressed, he starts using the phone and cuts off from the social relationship, which leads to worsening of the problem. Strengthen your support network. NIMHANS initiative, we have started an initiative which is known as SHUT Clinic, SHUT. What is this SHUT? Service for Healthy Use of Technology. Service for Healthy Use of Technology. This is the one which we have started now. It is called SHUT Clinic, and the need was felt because there is a lot of people who are coming to us based on inputs of the focus group discussion. We initiated this year. This is as fresh as April of 2014. We started the SHUT Clinic, and it has become very, very popular now to overcome the stigma, because there is always a stigma in mental hospital. They don't come to the mental hospital. So I have a problem. They think that mentally ill is discarded. So that is the reason that stigma to be overcome. So we have a center called NIMHANS Center for Well-Being. We use the word well-being, and that is a center, it is where the SHUT Clinic is there. And this center is located in BTM layout near Jayadeva Institute of Cardiology, very close by. So you need not have to send the people to mental hospital where they want to avoid coming there. That is the reason. The SHUT Clinic objects your raise the awareness, build up the manpower through training and developing user-friendly intervention. That is one thing which I am doing here, to create awareness among the people. And that is the reason I thought this would be the right topic today for discussion, so that when you go back home, each one of you, if you identify a person who is addicted to this, you must prevent that. That is the slogan which I am talking about here. We have this SHUT Clinic, Service for Healthy Use of Technology. We have these posters which are available. And experience in the SHUT Clinic now, getting users in the age group of 14 to 19 years. The treatment is being initiated by the caregivers. 3 to 4 meals per week across India, all over India. If you have opened now the media, I think every media covers this SHUT Clinic. Starting from even BBC, people have come, and your Indian TV, everybody has come to interview us. What is this SHUT Clinic about? This has become a major one now. So the resource material we have, are you too attached to your cell phone? This is the question which we ask. And then these are the posters we put across. You are not alone. There is about 4.1% of the people who are like you, who are addicted to the technology. That is the message which we have. And if you have a problem, please come to SHUT Clinic, which is there in the NIMHANS Center for Well-Being, which is located at medium layout. These are the resource material we have made, and this material has been distributed all over. The soft copies are there, and the hard copies, printed copies are also available. And these are all the ways we are talking about. You have seen many accidents happen because of use of mobile phones. How many of you have seen the people having the earphone and driving? Whether it is a two-wheeler or a four-wheeler. You know what is going to happen. You are listening there and you are concentrating on the top. How much you could concentrate on both the sides. I know many people are multitasking, but multitasking should be careful, especially when you are driving. And that is the problem. How many accidents are occurring now with the use of mobile phone? Already the police have been informed and they have taken the action about it, saying that people should not talk in the mobile phone and drive. You all talk about drink and drive, now you have to say another word, that don't use a mobile phone while driving. That is the very, very important, because a short lapse of even few seconds in a city like Bangalore can lose your life. You can lose your life because of that lapse. And that is the problem, and we don't know what the person is listening to, and whether there is something emotional. If there is a sudden emotional thing which comes out, the person may lose the contact and then lead to problem for himself in the life. So we have various resource material, overuse, cell phone and addiction like this, and media has led the awareness now, helping the web junkies log out. That is, you must have read in Times of India, which has come out saying that helping web junkies, they use the word web junkies now, log out of this. That is the problem. Internet addicted, shut is the answer. Shut. You shut from the technology. That is the answer now. So there are challenges. There are huge challenges in this. What are those challenges? Challenges are similar to any addiction. It is very, very difficult to get person out of these addictions. Whether it is a tobacco addiction, or whether it is an alcohol addiction, or a substance addiction. You must prevent this. We have to create awareness, sustain the promotion of healthy use, and enhancement of treatment seeking. It is not that you should not use internet. It is not that you should not use Facebook. It has a lot of advantages. It has revolutionized the whole thing now. Without that we can't survive. But at the same time, there has to be control for everything. And you should not get hooked into that. And this is the message which has to be carried on for the people. Sensitization of the parents to advise control use as a part of parenting. It's very, very important. As I just gave the example of that young little one at 5-year-old, the parents are very happy that child has learned everything about Facebook at the age of 5 years. It is as good as a 5-year-old child drinking alcohol. Can you imagine that? You can't imagine. You can't imagine a 5-year-old smoking. So can you allow a 5-year-old to do the things which they are not supposed to do? The parent encourages. Parent encourages them thinking that that is a great achievement. Then tomorrow the same parent has to encourage a child when he start drinking at 5 years of age. That is the equality. So you must think from that angle. So our parents have to learn. So all of you are here, many of you are parents, many of you are grandparents. Please look after your children or grandchildren from getting hooked into at that young age. Engagement of schooling and education department for sensitizing the teenager. How many times you have read in the newspaper now, mobile phones are not allowed in the schools. There are schools which have banned this, but the children cannot leave and their parent wants it. The parent wants it for the safety of the child. It is required, I know that it is required. But at the same time, they should not misuse. When the class is going on, they are starting with texting and looking at various internet. And you are not surprised when I said in Vidhan Chawda, some of the MLAs who are looking at what they should not do. And this is, nobody is exempted from that. And this is what is happening. Because the people are getting a thrill or kick out of those things. And that is the reason they are engaged in a work which they are not supposed to do. So the challenges are evolving user-friendly screening and intervention for the users as well as for the caregiver and a counselor. Building the manpower to raise the awareness. We require a lot of people, psychologists, a lot of psychiatrists, psychiatric social workers, but we do not have in this country. We have only 1,000 clinical psychologists for the whole country of 1.2 billion. Where they are, we don't know still. They are all scattered everywhere. So with manpower shortage of that nature, and we have 80 million internet users and people using the Facebook and the cell phone, you can imagine where we are heading to. So we have a major task on our hand. We need to take care of it very early. Otherwise, we will produce morose robots like people, wherein they will be continuously with the phone and not socially interacting. Building manpower to raise this is a very, very important. Your mind online, go for a healthy use of technology. This is what a mind will go through continuously and without breaking. That is the problem which we all face. And this is what exactly I wanted to communicate. And thank you for listening to this importance of technology. Thank you very much.
Dear friends, the lecture was